Yeah, good evening, everybody. As back to introduce us. So my name's Son, and I'm going to be doing the dentist piece on this. And Nav, I'll let you say your name.
I'm Nav. I'm a medic. Hey.
Cool. I guess the reason why we're doing this, so me back to Nav, all went to school together. Obviously, me and Nav are also twins. But the benefit of being twins is, if you can imagine, we have had a very similar upbringing, similar education, went to the same schools and everything, but we diverged in different paths. So as much as you can have a generic, dentist medicine talk, here it's all pretty friendly. We take the piss out of each other because we all enjoy what I do. But what we really want to get out of here is appreciate the nuance and the reasons why we chose these two different fields. Pop in as many questions as you want to factor in, because there should be some time at the end, and we'll go through as it comes. So here's the slide deck now. We're hoping to present for 20 and then questions for 10. We'll talk a little bit more about who are we, what happened in university. Then Nav will split off and do his postgrad bit, so what happens after you graduate as a doctor. I will then do my bit of what happens after you graduate as a dentist, and then we'll just take from there. Let's go.
So basically covered that. Talking briefly about my background then, I did my medical schooling in Newcastle and I graduated in 2019. I've been a doctor for around about 5 years and counting. Currently, I'm what they call an internal medical trainee. That basically means that I've decided to specialize in medicine for all the organs that are on the inside of the body. That often begs the question, what about the medicine on the outside of the body? And to that, I would defer that to a lot of my GP colleagues or people in primary care who practice a lot of preventative medicine. But essentially, any of the bits of the medicine inside the body, that falls under my remit. We further subspecialize later on down the line, but we can talk about that later on. Alongside this, as with everything, extracurricular activities are encouraged. And I had a bit of an involvement with the refugee charity, and I'm part of a committee that helps teaching in the UK. That's basically me.
On to me then. So I graduated from King's in 2018, and then in terms of postgrad stuff, I just completed my MFDS and then a PG cert. It's basically all about education. Where I'm currently now, so I've kind of taken a bit of a torturous route. All I've done here, there, and everywhere bits. But first, I qualified, worked as associate, worked as a hospital dentist, and then I stressed my mother by joining the British Army, and I work as a dentist for them. We can talk a bit about that later, but I think from the mainstay of this work experience bit, we're trying to impress on you what it's like when you get out there. Absolutely organize your own work experience, because it's very different when you get that boots on the ground. You get to see what's happening. But here we're trying to give you a flavor of what the differences are. And as Nav said there, obviously, variety is the spice of life. So I contribute to the BDA, which is the British Dental Association Armed Forces Group, and I do the dental bit because they like diversity on the DMEG panel.
I'd also say, so the most common question I'll get here, Sun will then explore the differences, but I think given that most of you guys are applying for medicine, my answer for why I did that is no different from a lot of you guys. I liked science, I liked talking to people, and I wanted to do something that was both challenging and rewarding. And I think at the time of when I was applying, medicine seemed like the most obvious choice. Obviously, there are many, many careers that I could have done that would satisfy those three things. And we can all talk about at the end if you guys are interested about how post 5 years doctoring makes me reflect on how I could have spent my time doing other things. But those are the main three reasons why I applied.
If we're going for the three, I'll do mine, which was people, science, and working my hands. So those were and dentistry in my eyes were the best jack of all trades. But again, later to come.
Outside of that, it's obviously very important to have a wider base. So my other personal hobby is dad jokes, and like Son commiserated earlier, being a real doctor, core part of my personality.
Yeah, fine. And obviously, you could imagine this. Obviously, Bax has turned off his screen, so you can't see this. But when we were in school together, he still had hair.
We'll get to it. We'll get to that.
Yeah. Okay, fine. Bax his head. Oh yeah, the picture. Cool. Yeah, crack on. Next slide, please.
That was our choices. Very briefly, let's talk about what your actual path as a medic will be. So that me on the left, Son dropping me off at Newcastle pre-uni, prior to Freshers Week, and that other photo is me when I was an F2. So that's about 2.5 years ago at St George's. And essentially, we're going to talk about the undergraduate life as a medic. As you would expect, there's a lot of studying to be done. And whilst a lot of the curricula across the UK are changing, what you'll often see is a common theme where you'll have heavily lecture-based or theory-based in your early years, whereas in Newcastle for the time was 2 years of lectures. And in our third year, we transitioned to clinical placements. This is a 1 week attachment, 1 day per week for like the entire year when you're into GP. But you also find yourself after having the grounding of theory behind you that you would go into hospital and see patients on a more regular basis. Dentistry and medicine overlap in their early years in terms of the science demanded, but certainly after third year, that's when you'll see things diverge. When it comes to extracurricular stuff in university, it's whilst you might think of medicine or any other degree you study as the main thing to do, there are lots and lots of stuff to get stuck in with. So me and Son took up fencing, me mainly being that it was the Olympics the year before, seemed pretty interesting. And Newcastle's cold, and I wanted something that was a bit indoors. And then some of the other teams that you see there are non-physical, but other group-based activities. Outside of that, having a social life and having friends is very important. And this was the last known sighting of Baxter's hairline, despite putting up
How did I
multiple
know
posters
that
to
this
search
picture
for
was
it.
going to make it into this talk? I just knew it.
It
This was
always
coming.
does.
You know what? There was a
It's
picture.
the only reason we do this talk.
We got to humble you, Dr. We got to humble you.
Well, I actually quite
Yeah.
like the fact that I don't have to use much shampoo
for
on my
those
head
of you who
anymore.
pick
So
medicine, this is the reason why you don't do medicine. Look at all of his beautiful hair. It's all gone. Look at me. I'm great.
Well,
I
now it's
think.
perfectly fine. So I would say it's more to do with genetics than anything else. But anyway,
Yeah, I
I'll
don't
let you
know
guys
about
carry
that.
on.
I'm purposefully leaving my chin tilted up.
Fair enough. You
And
know what?
Black Sharpie does wonders these days. Anyway, having friends is important, and life in university is not just about studying. Don't tell my Asian mom I said that. When it comes to medicine as well, dentistry very similarly, you can also have an opportunity to go on an elective. So in Newcastle, this is on our fourth year, and we went to a little country called Sri Lanka, and you can go out there, see how medicine is practiced very differently to in your own country. Some people do electives within the same place or other developing countries or developed countries, and there's an opportunity for traveling afterwards. Outside of that, I'd say one more common difference is you can decide to do another year that's outside of your degree, i.e., called an intercalation. I did a year studying global health and I spent some time in Tanzania, but other of my colleagues went on to do either cardiovascular research. One person did an intercalation in Spanish and use that to help with sort of like travel medicine. But there are opportunities to do other things, which this is mostly an optional thing to do. And a lot of the London universities, it's mandatory. So overall, what this will have you undertaking is 5 years if you're coming straight from school and not having had a degree before, i.e. undergraduate. If you've done a degree before and you want to enter a shorter course of medicine, that's 4 years plus one for intercalation. There are now some emerging curriculum that involve apprenticeships, and there's obviously a lot of things like the PA curriculums that are coming out in the last few years. But considering that most of you guys are probably thinking about standard entry medicine, that's what I'm going to focus on. If you guys have more questions about other stuff, you can talk about that later on. On to you, Son.
Sweet of the beat. I'll touch on the intercalation bit because I know when we get into my slide deck, I'm going to forget. So dentists can intercalate. However, it's very, very uncommon. Previously, I think it's fair to say now, a lot of medics would do it not just out of interest, but also you'd score points, which I don't think is the case anymore because they changed that system. But essentially, you can take a break out, do something different in dentistry. However, it's not really the common path. Is that fair, Nav? And then I move on.
Yeah.
Cool. All right. So in terms of your application, then, to be honest, fairly similar to medicine. You know, there's a huge shift to MMIs. I don't know of many panel interviews anymore. I used to sit on the interview panel for both King's and Birmingham when I was in those respective universities. The only thing that'll be different in terms of, you still need interpersonal skills, communication, be able to talk to patients. There may be some elements of manual dexterity. Now, some places will make you play with Play-Doh in the MMI, but it's not about being a master in your craft, but it's the ability to do something with your hands and then reflect on it critically is what they're looking at. Me, myself, those little figurines there, I painted Warhammer, so I was actually able to have that in my pocket in the interview. So when it came up at an appropriate time, I showed it to them. But, you don't have to be bringing out some huge case or whatever. It's just a nice to have. So whether it be you play piano or you like artwork and things like that, if you can show some element of manual dexterity, it's never a bad thing. Next slide, please.
I'm just going to add on a cheeky plug in there for the medical eye. So for those of you who get past the UCAT section, we then run multimedia interview courses later on in the year as well. And you may see Nav and Son as friendly faces as your interviewers there, maybe if you're lucky. They have been awesome over the last few years. Right, cheeky plug over, going back.
And if you're very nice, Son will let you play with his Warhammer. If you just say please.
And if you're very nice, Nav will let you do an inspection of his teeth because it's very easy to be a dentist. in before they made that joke. Right. This is the bit that diverges. So Nav talked about earlier in his slides, there's very heavy theory elements, very similar for medicine and dentistry. And that's actually very true. For the first year, I felt like any other med student, because you're basically all theory based, but slowly, that will generally build in doing more and more clinical work. So you would start on phantom heads, which is what these pictures here, and eventually that'll build into treating patients. So you can imagine by the end of it, when you're in fifth year, it's pretty much treating patients the entire time with some theory elements of their job. And that makes sense because dentistry ultimately is a very practical degree when you get to it. Next transition, please. And yeah, this is basically just showing that bit. You present your skills. Every uni does it differently, but that's just a poster. As Nav talked about, now just flick to the next one. As Nav talked about, loads of extracurricular stuff and absolutely variety is the spice of life. If you just do your degree, whether it be medicine, dentistry, or vet, it gets very boring and you probably will burn out a bit. So get it amongst it in university, or perhaps maybe even in school right now. And I'd also probably say for Nav, we're a bit late to the game. We're like, oh, we're going to apply. God, what sport can we do? Oh, we can run. Let's join the cross country team. Yeah. So we're very late to the game. But if you have something to say that there's a little bit more to you, that's never a bad thing. So whether it be running,
we can talk about the late to the game stuff later on in the end of the talk.
Yeah, we do. Or just getting involved. That's good. And then from our elective, I went to the Amazon jungle. I did dentistry on a boat for a little bit, and that was fun. And I would say, post-COVID, it's a little bit harder maybe, and the enthusiasms for electives aren't necessarily there, but it is a great opportunity to do something you probably otherwise wouldn't do. So go out there, go to another country, or hell, do it in the UK and go to a hospital attachment and just make the most of your elective because you may not get that time again. But yeah, it was awesome.
Sweet. Okay, now we've talked about your undergraduate life, and it's probably time to talk about what our daily lives look like. I'll talk you through general stuff about being a doctor in the NHS. So this is from the perspective of a medic. We can talk very briefly about surgery and other specialties, but as a general normal shift, 9 to 5 on the wards, you would tend to have the time where you would come in early and you would prepare the ward list of patients. By that, I mean, for all the patients in bay 1, 2, 3, and each bay might have 4 beds, you'll make sure you have a list, a spreadsheet that you can print out and take with you when you start the ward round, i.e. seeing all the patients and person bed 1, bay 1, bed 1, 2, etc. matches the name, has a problem list, so you can go see them. At 9 o'clock, we tend to start the board round, where you gather all the members of the multidisciplinary team. That involves not just the doctors, i.e. the clinicians, that's everyone that's involved in patient care. When you go to some of Bacter's more work experience talks, etc., and his reels will talk about them quite often, that includes things like pharmacists, physios, occupational therapists, dietitians, speech and language. And to give you an example of what their roles are, for instance, if someone has a stroke, damage to their brain, which means that their swallowing is impaired, you might get someone who specializes in that, speech and language, to come see them, or at least discuss their case in the morning board round. So this is an opportunity at the start of the day to go through everybody on the ward, to highlight to your members of the multidisciplinary team. They fall also under the bracket of allied health, so that's dietitians, occupational therapists, physios. You might flag to them, say, hey, speech and language, bed 1, 2, probably could do with a swallow assessment. Do you have time to do that today? And so on. And you talk about all the barriers that they might have to discharge and how to resolve them. After that, then you would begin to go see all of those patients on the ward round amongst the clinical team. So now, as the NHS is changing to include a lot of other, not necessarily doctors, you have physician associates, you have advanced care practitioners, i.e. highly specialized nurses, and sometimes you have senior house officers, so basically people who are doctors of year 2 and above. You have registrars, which are more senior medical trainees who are within a subspecialty, and then you have consultants. So I've forgotten, I guess I haven't included house officers. So those are doctors in their first year of training. As a group, you go out, you see all the patients amongst yourselves, and you tend to create a list of jobs from seeing everybody. So that way you have a good itemized and organized list of knowing who needs bloods, who needs requesting for chest x-rays or CT scans, who do we need to refer to other teams like cardiology, or in very rare cases to the dentist, i.e. maxillofacial. We'll talk about that later. Or who needs a discharge summary because they're going home today. You'll split that amongst your team. You might go for lunch or departmental teaching on a good day. And then after that, you'll come back to the ward round, complete the jobs, And then towards the end of the day, heading towards 5 o'clock, you want to wrap up any leftover jobs and review unwell patients. There's a handover list. So for instance, if bloods haven't come back, but you need a doctor to chase them, we call to look at them out of hours, you would hand that over to the on-call team, which we'll talk about in the next slide. We've talked about what the multidisciplinary team means, and home time is 5 o'clock. I would say that's air quotes on that 5 o'clock, but that's kind of what the target you would aim for. And when it comes to a surgical shift, surgical ward rounds are often much earlier because all of the senior team, the registrars, the consultants, they want to be in theatre doing surgery, which will happen at 9. So they might want to tend to ward round sometimes as early as 7 o'clock or 8 o'clock. And certainly when I used to work in cardiothoracics at St. George's, I was up around 6 o'clock to start my ward round about 7 o'clock in the morning. So yeah, early starts, but the ward rounds are much faster. So when we come to on-call then, this is not a ward shift. This is either you are doing, as I said before, and you are taking jobs from other wards, say the cardiology ward or the lung ward, the respiratory. They call me as the on-call doctor to say, hey, Nav, this person's bloods are outstanding, as in not amazing, as in they are yet to happen. Please, could you chase them, make sure the potassium is okay. If it's low, replace it, for instance. So you get handed over a bunch of jobs as one part of an on-call job where you're covering the wards. The other one is when you might be seeing all the new admissions that are coming from the emergency department. So back to works in A&E, people come in with a wide variety of conditions. As you can see on this is our take list. So if a person is unwell enough to be deemed they need to stay in hospital and they have a medical problem, not a surgical problem, not a psychiatric problem, they will refer, and backed as people, I would like to say that, will refer to my people, the medics. And I just like to include this slide and this picture to say that medicine, as wide and wonderful as it is, can present with a menagerie of things. And one person's issue might not necessarily be your issue. So this is in the height of the COVID pandemic. And if you look to the bottom, which I've highlighted, somebody had a very key issue that was, I guess, concerning them, that they wanted to come into hospital in the context of all of the uncertainty and scariness that was happening with COVID. So it was safe to say he was the first person we saw on our list, and lives were saved that day, for sure, for sure. This is another doctor and myself covering the wards. You have pages or bleeps. So when a nurse or somebody else needs to highlight to your attention, they will contact you on a bleep and you would answer it via that way. When you are on call, is very, very much a mystery. Things you find in the notes, you're encountering patients you've never met. And I just came across this the other day and saw this in the notes and thought it was quite funny. Now, this would definitely probably prompt a referral to Sun for some education, but just highlights how we work together as a team. You know,
MDT. You know,
I don't think it was.
Yeah, sorry. Yeah. Full mouth clear. Coke Zero, man. What are you doing? It's crazy.
Yeah.
Would it be all right if we drank 4 liters of Coke with a straw, Son?
Well, actually, if you're gonna do it all in one go. So it's actually not that bad, you know.
Yeah. I'll let you guys carry.
The amount of time that would have taken.
You're not a qualified dentist. You can't go out advice like that, you know. That's negligence.
I'm not saying it's a good idea, but out of the two evils, probably doing it with a straw is a better idea than doing it at all, right?
Yeah, no, that's
right. Everybody, if there's one thing you take away from this talk, the Medic Life advocates for 4 liters of Coke to a straw.
That's what I heard.
I'm gonna have to now put in a disclaimer that is not what the Medic Life does, right?
And then, just like everything else, being a doctor is more than just ward-based duties. You can get involved in leadership projects. You can get involved in teaching some of your colleagues, or you can get involved in academic research. There's a lot of variety in medicine, and that's why I think so many people pick it, because you can make a lot of it. Okay. Postgraduate life then. So this is, you've finished university. You're just about to graduate. So this is me in 2019. I completed my foundation years. So it's mandatory to do F1 and F2. That's when you get your GMC certificate. You're fully licensed to practice medicine. And that's when you might embark on different training programs. Loosely speaking, you can go on to general practice. So that's three years. You can decide if you want to do medicine, which is a 3-year curriculum, and I'm on the 2nd year of that. You can apply for surgical training. That's a 2-year course. And then you can do other specialties like pediatrics, psychiatry, obs and gynae, basically women's health. Or if you don't want to embark on the treadmill training pathway, you can take a year out. You can take multiple years out as well. And I spent my time, I went to Australia for a year. I worked in Brisbane with my partner, and it's becoming an increasingly more common thing that we see people do.
Midlife
Over to you,
crisis.
son.
Thank you very much. This slide's actually more out for those vets out there, so there's something in there for you. Nav had a slide with a cat on earlier. Sadly, didn't actually do any treatment for this. It was just a sloth that got marooned while we were in the jungle, so we just obviously cheeky picture and back out. Anyway, so Nav finished with the postgrad bit. I'll just talk about the postgrad bit, and then we'll actually go into the nuance of what it's like as an associate and beyond. So you graduate, and much like the doctors, you will do, well, the vast majority of dentists will do a year called dental foundation training, kind of like the F1 equivalent, except it's only a year. And essentially what that does is it gears you up and gets you ready to work in the NHS. Differently for the doctors, though, obviously, if you looked at Nav's slides, before you become independent and truly on your own, as it were, it may take 10 years. That's the minimum to become a GP, right? Whereas in dentistry, after you qualify...
5 years for a GP, son.
Sorry, but I'm including 5 years of medicine, 5 years of training after.
Fine.
So
okay.
Sorry, yeah. Thank you for stopping me that. Whereas with dentistry, you qualify after your 5 years, you're pretty much good to go, and you're the package. And that's one of the common questions I get, like, why does it take 5 years if you just do teeth? The reason it takes 5 years is because you can do teeth when you finish. Whereas in medicine, although you're a skilled generalist when you leave, you still need that extra minimum 5 years, give or take, to get you to where you want to go. So yeah, like I said, a lot of people
say, you do practice independently, but if you're chasing the formal qualification, the certificate of completion, CCT, Sun is right in saying that it would take a minimum of 5 years post medical school, i.e., 2 years of foundation training, than 3 years of a GP, and that's the quickest way to obtain a CCT. Carry on.
Yeah. No, thanks. Yeah, good to check that. So DFT, then on to the next bit. So this is when it gets very much make it your own, as it were. Click the next slide now. Or next, thanks. So a lot of people then will go into being an associate, so as a general dental practitioner, very much like what you'd expect when you see a GP. This is just the dental equivalent, and they're kind of like the front of house, the most common type of dentist you'll see. However, some people choose to actually spend some more time in hospital, and so they do some more specialist jobs. So that's a dental core trainee. And then after a couple rounds of the wheel of doing that, you may then choose to wish to apply for specialty training within dentistry. There are currently 14 specialties recognized in the UK. So that could be max fax. It could be what's probably more known to you guys, orthodontics. So that's people who move teeth, and then many, many others, which if you're interested, it's worth just having a general look. So you can mention it in interview if you want to. However, then there's also a lot of the gray area, because although you can be an associate, that can mean many different things. It could mean you work part-time, you do evening clinics. It could be that actually you don't really want to do much dentistry and you only go into practice ownership and multi-owning practice. We'll talk about how you can carve it and make your own, but essentially what I'm trying to get out here is after you qualify in those 5 years, it's not as structured unless you want it to be and you want to go down the specialty training route. And when you become an associate and you're an independent practitioner, i.e. you run your own things, you treat your own patients, you make your own treatment plans, there isn't necessarily always shadowing you and fact checking everything that you want to. Next bit, please. So what it's like as an associate, and this is the thing that I alluded to earlier, is essentially you are the face, you're that patient's first point of call in that journey. And the benefit of that is there's minimal hierarchy. So unlike in university where you had to fact check everything with your tutors and things like that, after you qualify, you are your own person, you have your free agency, you can treatment plan for your patients together, and within that you have the clinical freedom. Obviously some constraints, you can't use the most expensive things on every single patient and take as much time as you want. So it's within limits, but you have the freedom to do the things that you want to, which is great. And you can make a really big difference. And I think that's one of the most impressive things about dentistry is that for some people, the smile can mean a lot of things. It's not just eating and pain-free and what have you. It's that psychosocial aspect of a smile. This case here, really, really simple, just a bit of whitening and some composite bonding, fix that midline diastema, which is essentially the gap. And that patient was really, really happy with their smile. And then the other bit that I talked about earlier is the flexibility. So, and often it's one of the things that I think I appreciate a little bit in the later life is, let's say you want to start a little bit later and it works with your practice. You could start later and do the school run. You could do 3 days a week and do a very, very long shift, or you could alternatively work the weekends. It is very much up to you and your practice how you want to do your gig. But with that, though, does come downsides. And Navi, you just keyed both of them. Yeah, thank you. It can be very stressful. And this is, I guess, the downside of being independent so early is that the buck stops with you. So unlike, and we'll talk about this a little bit later when I talked about hospital dentistry, is you have consultants, you have senior supervisors to go to. But if things go wrong, not that you can't ask for help, but sometimes it's very difficult, especially if you're the only dentist in that practice. So the stress of doing that, especially in your early career, probably often leads to burnout and people feeling quite overworked and working quite hard. If you think about the margin for error in dentistry, if I take a hair out of your head and put it inside your mouth, obviously that's not great, but you will definitely feel the difference inside your mouth. And that's the minutiae of error that you're working towards. There's also the time pressures and you have to work quite quickly. And if I compare it to my time in hospital, I was very much working pretty flat out. You know, if I didn't have a bum on that seat when I was working as an NHS dentist, then you're not getting paid because you're self-employed. So if patients don't turn up, you're not earning money. So there's that crux of self-employed and you're not salaried. So what does a general day list look like? So if I had a 9 o'clock list, I'd like to get in a little bit early, change, and then have a little quick look at my list so I can scan ahead of what's going on and talk to my nurse about it. Much like the doctors, you do work in a team, but it will usually just be you and your nurse. So it's a very small knit team. And although you may think of practice having multiple dentists and many different surgeries to work in, you can be in a very busy practice because you're inside that room the entire day. You may not actually see anybody, but it's just you, your nurse, and maybe your receptionist when you go outside. But as you can see, that's a pretty busy list. This was obviously a pre-COVID list, but by and large, this is what they work towards now. But if you were to read into that a little bit more, there's quite a lot of variety in your day. So it goes from having checkups, a routine activity, dealing with emergencies, that people you may call up on the day and are having a problem, to then the stuff that you've booked, whether it be fillings or taking out teeth or dentures, which are essentially false teeth. If you were looking into that a little bit closer, and this is when I'm talking about the work experience bit, there might be times when you want to change your diary and how much time it takes to do things. So for a new patient, you can probably appreciate they are new to you know nothing about them. So you probably want a little bit of extra time to understand them, what their problems are and how you can help them. Flip side then, an emergency, because that person might be in pain. So you need that a little bit extra time to help deal with the problem. Whereas you have booked activity, whether it's you've booked that extraction in advance, you've booked that filling in advance, this is something that you've already seen and treatment planned before. So you can maybe speed those up a little bit. Unlike Nav, when he talked about the 5 o'clock finish, by and large, I would say I was more likely to get it within the dental space. That hour lunch, though, that is a bit of a lie because often admin, referrals, what lab work, whatever it may be, bleeds into that time. But generally speaking, I would say as a dentist, I finished more within the hours that I was supposed to work, generally. Next one. Yeah. So what I'm basically trying to highlight here, because the question could come to you. So obviously we went through a global pandemic. What happened to dentistry and how are we getting back into normal? So at the time of the pandemic, dentistry was a very high risk activity because everything to do with COVID was about, obviously minimizing patient contact. If you could, with dentistry, you're pretty much right up in their mouth. And when you're using drills, you're also aerosolizing all the particles, which is something we call an AGP, which is an aerosol generating procedure. Some of the measures that we used to combat that was wearing more and more PPE, wearing specific kinds of masks, but also after we used or any hand pieces, so generating that aerosols or the sprays, we would have to let our surgeries fallow, so i.e. the dust particles to settle and clean them. So we weren't able to work as quickly or as fast, and so that's what I've crossed out here. As you can see, the day list got a little bit shorter. Now we are a few years on from the pandemic, so those things are more historical, but certainly you could expect, so what happened to dentistry during COVID? And that's a big one. So you can move on to the next one now. So I talked about dental training. So this is, I would say, a little bit less of the common trod path. Bacter and Nav hate this slide because essentially what I did was, with a weekend of training, I essentially became a doctor on the ward. And because I was an SHO at that bit, I was more senior than a house officer. So weirdly speaking, they would actually have to present to me, even though I didn't really know much about medicine apart from what I watched in house. So
I would preface it by saying that obviously Sun is an expert because this is him working as a max job, so basically head and neck surgery relevant kind of stuff. And in this weekend crash course that he had, if he was getting bleeped by nursing teams to say, "Oh, can you prescribe fluids for this patient?" Sun would be calling me up, being like, "Fluids? What do you mean? Just give the guy Ribena or whatever he wants." They're obviously talking about intravenous fluids that you would give, but they don't really get training on that. Same goes for ECGs.
I think sun's probably the reason that guy had 4 liters of Coke as fluids.
Yeah, exactly. Whatever he wants, man.
Coke stat, please. Yeah, give me.
He's
give
sick in hospital. Give it to him.
Yeah.
Yeah.
Actually,
carry on.
No, that's fine. My first 5 minutes on the ward when I got on there, someone came because they didn't necessarily know. It was like, "Oh, doctor, can you prescribe fluids?" And I was like, "Hartman's. I've seen House. Yeah, no, it's you're there because you're a specialist in the head and neck stuff, but there are doctors in the ward and you share that stuff. But anyway, so how's it different to being an associate then? So primarily hospital based, sometimes feel like an F1, which is what I was essentially alluding to there. Because just like Nav talked about, you have ward rounds, you have consultants, you have surgical time if you need to. But then the flip is you are now at the hospital hierarchy. So before, when you were pretty much almost an independent practitioner, making your own treatment plans, making your own decisions of the treatment that you want to do and carrying that out, now you're back in a wider team. So it has that benefit of you have people with you, but now you have less agency to make your own treatment plans. And rightly so. I wouldn't be the one responsible for planning complex head and neck cancers, but you're basically back in that hospital hierarchy. The benefit of is those that you then in that privileged environment is then you can develop extra skills. So this is me outside my DC year where I was working in Great Ormond Street. And as an example, this is something you'd never get to do in an associate, but the consultant, we were doing a bone graft for how would I say it? So it was a kid with cleft palate, and one of the things that they don't have is bone in the area of the cleft, so you have to harvest bone from another side. So we did something called alveolar bone graft, where we basically nicked a bit of bone out of that child's hip and then put it inside their mouth, which is not something you'd ever do as a dentist, but with that consultant supervision, they allowed me to do it. So that was quite novel and helped increase my surgical skills. But as with being in a hierarchy, again, the downside is, now if you really want to go to that slide, huh?
No, it's all right. Carry on.
No, it's all right. You get less autonomy to your things because now you're in a hierarchy, and it is challenging. There's a very steep learning curve because you're learning things that are unfamiliar to you. You haven't had 5 years of med school to get you to that point, and not that you're going to be doing medical things, but you will hold the on-call bleep depending on what trust you're in and all the things that come with it. You will go down to A&E, you will see people with cuts and lacerations and things like that. So dental school doesn't necessarily prepare you for this, but within that, it gives you a new set of skills that you can either continue to go down the DCT path or take back to practice if you choose to do so. Last slide, please. Now, the thing that Nav also alluded to in the end, but dentistry is definitely awesome for this, is to carve your own career. So although I did work in the NHS for a few years, I went the very unconventional route and I joined the army afterwards. But whether you wish to do part-time or portfolio careers, which is very common now, you can do a little bit of law, you could work in community, you could have a job teaching in university, you could do outreach, work in organizations, you could do down the business route if that's what you're really interested, or working as a specialist, as you can do also in medicine. So lots to do, and basically make of it what you will.
I would say you can do these things in medicine, like take Baxter, for instance. He's spending a lot of time in the emergency department, but he's working on things that give interest to him, like winding participation talks and helping all of you guys be here. In medicine, though, it's slightly more tricky to do that because a lot of the training pathways are regimented. They're very hospital based. The people with the most flexibility, very similar to dentists, are GPs, and they might often have some of these other interests, but it's harder and less easy to have them. You work quite hard for it. And I guess one of the core differences to highlight in this, if you like working in big teams and full of people, you kind of have to be in hospital. So you can get that as a dentist, work in hospital, but you won't necessarily have that as an associate, if that's fair to say.
Yeah, no, I'll take that. And just like Nav said, working as a hospital dentist as a DCT, you get back into that regimented nature. So yeah, makes sense.
So this is basically the end of our talk. And after a really long day, hearing also from medics and dentists, it's very understandable that a lot of you guys were probably feeling a bit nervous and anxious about the future. And I just want to take
Especially
a pause.
after doing UK cat teaching. I hated that exam.
Yeah, I know, man. When Baxter was on the slides, he was like, just count the thing. What comes after 2, 4, 6? And I was like, who do we appreciate?
5,
Oh, and no,
7.
it wasn't
Oh,
that.
no.
2, 4, 6, 8. Yeah.
If you guys had all the techniques and tips that you need for the
UCAT, here we go. Plug it again.
I'm also always gonna plug. Of course, I was gonna take the opportunity to do the plug. Right. Sorry to disturb. Carry on.
No, I think this 5 minutes, I just want to spend just talking about mental health because I think it's very important. And if we don't look after ourselves, you can't look after other people, which whether you're a medic, you're a dentist, you're a vet, or whatever path you choose, it's important to look after yourself first so you can be there for others. And so we're just going to talk through a series of photos and a bit of our journey, and then we can end it to talk about questions you might have. The first thing I want to say, kind of how I was preempting this, is with all the anxiety you might have hearing from me and Son, I must say we are now, I've been in this pathway for 10 years, did medicine for, sorry, 11 years now. So 6 years of med school. I took a gap year before, and then I took some training time out. All these qualifications, if all of these things that might seem daunting to you, I'm 30 years old now, so I would not expect you to have. And if you do have some of those things at your age or where you're applying, that's amazing. And I would preface this by saying, at our AS levels, when me and Son first got our results, we were very, very, what's the polite way to put it? Basically, my mum was very not happy and threatened to disown us when we came back with our report card. That's probably the easiest way to say it. This is a time when grades had letters and we were allowed to have retakes. So a different kind of kettle of fish. But we were very demoralized after our first set of results. And on top of that, when I looked at a lot of people in my school who were applying, they seemed very extracurricular, very motivated. And me and Son only kind of thought about medicine and dentistry kind of late into the game. So as he was talking about before, we thought to ourselves, what is the only thing that we could probably gain to do an extracurricular activity that we might enjoy? And we ended up joining the cross country team, which, you know, if you're looking for stuff to do, all you need is a pair of shoes and run. But that was quite good for our mental health and also gave us something to talk about into. So what I want to say is, regardless of what we've said, and regardless of how scary it might be or how it might seem daunting to become one of us or other parts of the team, you lose nothing by trying, and you got to shoot your shot. So
it's 100% of the shots you don't take, right?
100%. The other thing I was going to say is that this period, however you skin it, is going to suck. And I think you all need to ask yourself that perhaps all of the things that you are going through right now are training you for what you have asked for or preparing for. There are going to be some dark days and really hard days in both medicine and dentistry. And sometimes having worked through and felt like you earned this place will build resilience for those dark days. And I certainly know, looking back after having imposter syndrome is rife throughout, I guess, life, but knowing that, hey, I got the A levels, I got the UK CAT, you know, somewhere, someone has given me those grades and believed in me. So you have to believe in yourself, as corny as that is. But you just got to put up with the work that you need to put in for now and hope that it pays off later on down the line. Even when that's said, and this is something I think we all struggle with, I certainly do, you have to remember you only have control over a certain amount of stuff. So if a grade has happened or you haven't met a deadline for something else, honestly, don't worry about it. We spend so much time worrying and stressing about things that we have no control over. And that's exactly it. All of these processes that we're talking about involve luck. And the fact that you're here at Bacter's workshop, the fact that he's talked to you about other opportunities and you've stayed to the end of quite a long day, you're already reducing the amount of luck that you may need to pass in these interviews. And that's all life is. It's about putting in the work to reduce the element of luck, but recognizing it's still there. So whatever avenues you have, if you have an up and coming exam, if you have other things you can sign up for, you can control those things. So try and dedicate your effort and time into looking at what you can actually change. The last slide, I think I'm probably going to hand over to Sun and then later Bacter, because I think they have more important points to talk about their journeys. Over to you, Sun.
Cool. So, yeah, I think... Am I echoing me? Is that me? No. I think, again, really, really important slide. I mean, I've always liked talking about this a bit because it gets very common to go straight into the work experience a bit, but actually not to recognize that it's very stressful. And I remember how stressful it was back at that time. And those three quotes are some of my favorites. But to touch on the last bit. So if I was to look at my journey through, well, dentistry now, all of the people who have had a knock at some stage, in my opinion, make the better clinicians. Whether it's you get that knock because you don't get in first time, or as I've seen some of my colleagues, they got that knock. When they're in dental school, they failed the year and had to repeat, because the threat of not getting what you want makes you reflect and realize, do I actually really want this? And that happened to me. I got straight up 4 rejections the first time I applied, and I was like, why am I doing this? Is it actually right for me? In fact, actually, when I was going through the process, there was one of an interviewers on another course way back when, and it was their 7th time applying to medicine, and then they got it then. Now, I would argue, if it's your 7th time, you really got to think if you really want this. But generally speaking, don't compare yourself to other people and what they're doing. Comparison is a thief of joy. And your career, if you really want this, it's a marathon, not a sprint. So if you don't get it straight away, take a step back, take that check pace, and think about, what was it that got it wrong this time? And do I still really want to do this? So for me, I realized it was actually work experience. I didn't barely do any. And so then that summer, I absolutely nailed my work experience and made sure that dentistry was something that I really wanted to do. And that totally changed my mindset when I went to the interviews the following year. Because in that time, I didn't actually view it as an interview. It was just a discussion with all of my interviewers. And I actually really, really enjoyed it. And I got into pretty much everywhere that I wanted. But the important thing I found to recognize, especially since I've become to the other side and been an interviewer to see new candidates, is I've never been trying to catch anybody out. And actually, what I'm trying to see from the person in front of me who I'm interviewing is whether or not they actually want to do this. And also, if it's the right decision for them, because sometimes you don't know. And it's a very big decision to make when you're only 18 years old. And although at the time I might say no, that doesn't mean no for now. It may be, hey, just take that check pace, think about what you really want to do, and then re-up and come back again. So all in all, everybody's journey is different, but don't feel like you have to do everything right every time immediately. It's a marathon, not a sprint, and enjoy the journey. You'll be better for it.
I think it's very important to say, as you said, the interviewers generally, medicine, dentistry, just to highlight, they're not your enemy. If a no is no, it doesn't mean no forever. And maybe if you had to take the year out, then you'll come back and you'll hit the ground when it comes to doing medicine and dentistry, a much more mature, much more capable at handling the stresses of university and make more of it. So it can be a good thing.
Yeah. Cool.
So I think that's enough of us talking. Back to, do you have any questions to answer, or do you have like maybe whilst we're doing that in the background, you could put a poll up to see if we've changed anybody's minds?
Right.
But
So I
thanks
know
for listening, everybody. I should
Sun
say.
was very passionate about converting people over to dentistry, so it will be interesting. Guys, we're going to pop up another poll to see if any of you have changed your mind.
While he's doing that, I'll answer a question that I got as a DM. So should I put my calligraphy artwork in my pocket when I'm going to?
Tell you what, let me come back in 1 sec.
Oh, go for it now. Whilst you do that, can you actually stop your share screen, and I'll put on my share screen as well, actually. Thank you very much. So just stop share. And I'm going to go ahead and share here. Right, guys, so the QR code back up again. So this is a Q&A slide. So for those of you who wanted the QR code for the UHAC course and also the broadcast channel, that is up. Don't forget the Medic24 discount code for 20% off. And then what I would like you guys to do is, if you have any questions for Sun and Nav, go ahead and pop them into the chat box. Ideally, like they're gonna start going blah, blah, blah on the chat box, because I know there's still quite a few of you guys here now. So I'll pick some out and then I can start answering them. And Sun, you had one that you wanted to answer straight away, isn't it?
Yeah. So I've got 3.
Okay,
If possible, instead of DMing me, could you just DM back to, because he can filter it while we're looking through, because I've just got 4 DMs come in. But anyway, the first one is, should I do calligraphy offer? Actually, they seem a lot like manual dexterity ones. Generally speaking, it's not the be all and end all. You can train a monkey how to drill, right? But that's what dental school is there for you. It's to get you there. You don't have to be an artist by any means before you get in there. But you have anything to show for it. Maybe it's a picture on your phone or a little printout. Just have it in your pocket. And if it naturally comes up in the MMI, if it does, then you can show it. But generally speaking, it's not something that it's not the hill that I'd die on. Someone said they're dead set on medicine and now leaning towards dentistry. I'll take that. Actually, it's a lie. Don't do any of it. Leave.
It's not necessarily I talked about it before. Like I said, the skill set that people like, either liking science, wanting to help people, that blends into other stuff. And I think often when people have asked me other things that I would have done, I would have probably been a teacher, I think. Was probably the most common and logical answer. My dream would have been astronaut, but I'm poorly sighted, and I don't think the UK had a program for that.
Yeah,
But that would have been cool.
You
But
know,
teaching is
you
probably the
mentioned
realest
teacher.
path.
Isn't the Latin translation for doctor is a teacher, I believe.
really? I thought the translation was go
Dottore?
on strike.
Was what? Sorry?
Go on strike? No.
No, maybe that as well. A bit of that too. But yeah, I think it might be because that's what we do, isn't it? We educate people, we teach, and we improve. I mean, I don't know how much dentists do it, but doctors definitely do.
What do you mean? Back to every time you go to the dentist, don't they lecture you on not flossing? That's teaching,
No,
bro.
they just
Every
don't even
time.
let me talk. They ask me questions with like three tools in my mouth. I'm like,
Yeah, that's
right.
you have to learn that. Anyway, yeah.
Another
So back.
question.
What are the questions?
Yeah, a question for what made you choose the army, son?
Uh, so generally speaking, I'm going to do this quickly because obviously it's not the purpose of this talk. But the things that I realized I really enjoyed after finishing is I like challenge, I like a sense of purpose, and I like working in a team. The army basically gave me all of those very easily. The dentistry I practiced was all patient focused, gold standard dentistry. You know, it was the best jack of all trades. And essentially, I think I just had a midlife crisis, and I thought that's cheaper than buying a car that I couldn't afford. So adventure.
A question for you, Nav. You're probably better suited to answer this. So someone's asking basically, at what point does the training for a physician associate stop in comparison to a doctor per se? And just like a simple pros and cons, I guess, if you want to talk about that slightly.
Sure, very topical question. I would say the answer is no. The training never ends, regardless of what pathway you take. They always talk about healthcare as lifelong learning. The key difference is, I would say, so physician associates are people who have done a degree before, normally a 3-year course, but it can be anything. It doesn't have to be science related. And then they can embark on a 2-year physician associate course and then practice. And the way it's meant to work, say, for instance, I did English literature at uni, then I did physician associates. They would then go on to one single rotation and stay there forever or a really long time. And through that, they gain lots of experience and training. So the way we see it diverge is that medics would tend to have a breadth covering all parts of medicine and surgery, whereas PAs are very finite and focused in one aspect. PA courses do include a breadth of like medicine and clinical based medicine, but it's very specific when they leave. And the idea is because they are specialists in one areas after they graduate, then they can be very useful because they don't rotate like other trainees do and can provide continuity of care to the places they treat.
Awesome. Thank you very
But
much.
there is no such thing as training ending. You are there forever until you retire and die. Your hair.
I'll sleep when I'm dead.
Yeah.
Right, there's a lot of questions about interview style questions, which I'm going to leave out just because that's something for us to worry about at a later date. There's a couple of questions about personal statements. That's something we're going to cover at the end of the month. So there's going to be a personal statement workshop. Once I finalize the date, I'll let you guys know about that as well. Son, a question for you. Can you do a PhD after you finish dentistry? And is that something people do?
Yeah, you can do. Again, less so. Less. It's not a very. I'm under my words here. Not very often, but yeah, absolutely you can. Granted, you can do a PhD in pretty much any field. It doesn't have to be dentistry, medicine. You're basically doing a very, very complicated piece of research in some area. But yes, you can. And then you're a real doctor, according to them.
Right. This is a great question for you guys, actually. So we've got a person here who basically can't decide between medicine and dentistry at the moment. They can't see themselves doing anything other than those two. So which one? Nav, you've seen Sun do what he does, and Sun, you've seen Nav do what he does. Could the two of you unanimously choose one? What do you guys think?
Do you want me to start?
Yeah, now you go.
All right. The first step I would take, as Sun did, get as much work experience as you can in the medical sphere and get as much work experience as you can in the dental sphere and kind of have it. You don't necessarily need it near symmetrical because I think the core thing would be to get some time in a practice in dentistry, hospital-based dentistry. You don't necessarily need that. You'll get the idea of what being that is because they're very similar to medics. But that's the first thing I would do. And I guess the thing is, it's very difficult to know what your life priorities are going to be in 5, 10 years' time. But certainly, a lot of people in my position, the things that we regret or we are sad about is not having flexibility over our hours and being committed to different parts of the country. So we didn't talk about it, But after you now currently graduate med school, you can be placed anywhere in the country for your foundation years. It becomes very competitive the further along you get. So you don't know where you're going to be an IMT. I was lucky that I managed to get London placed for my foundation training years and London again for my internal medical training years. But I know people who could be scattered everywhere. So arguably, if things like flexibility and having ownership over your life is very important, or you think it will be, and you're kind of undecided between medicine and dentistry, then I would say, you know what? Dentistry gives you more flexibility. You can pick your hours. You can pick what kind of streams of dentistry you want to do. You could do charity work. You could do other things that give you joy. And if they're very similar, I would probably pick that. But if you want to pick a career where you're not exactly as fussed about that stuff, you're not sure what kind of field you want to go in. Do you want to be a medic? Do you want to be a surgeon? Do you want to be a psychiatrist? Do you want to do all of those things? That might work. Another way of combating that question is to say you can do maxillofacial surgery and basically do both degrees. I would argue that's suicide for
Yeah,
masochists and people who like suffering. But if you do it as a dentist first, the key thing about being a dentist is having really good dexterity. You won't develop that with a medical degree. So some people do dentistry first. If they really want to do medicine, they will go and do a 4-year course in medicine or 5 years, and then they will do dentistry on the side so they keep up their hand skills, which generally works well. You can do it either way, but that would be my advice. Son?
Awesome.
well, yeah, I was basically going to say work experience is the way it's split. That's how I figured out what the nuances on the different side. Because originally, I was dead set on medicine when I was thinking about it. I was only doing my dentistry work that flipped my mind, because I realized when I was doing the surgical work experience, that was the way I wanted to go, because I like working with my hands. The good surgeons, and I'm generalizing here, they wouldn't see their patients again because they do the surgery and then they're asleep, those patients, and then they don't have that continuity. Whereas when I did my general dental practice work experience, this dentist was seeing the same people for 20, 25 years, was a family dentist. He had that patient rapport. And there was this one patient who came in, and every time she saw him, she'd bring in a chicken casserole. And I was like, damn, that's exactly what I want. Food is the way to my heart. So I was like, yeah, this is what I want, that patient relationship. And I think the answers for you about what you really want to do genuinely is just sit in a dark room and just think, what do I actually enjoy? Me and Nav talked about at the very beginning, what were our top three? And for me, it was people, science, in my hands, and Nav had his own three. But don't feel like it just has to be that. Medicine is still an incredibly rewarding career, and even for my brief stint in hospital, you get to see patients at their best and their worst. It's incredibly rewarding, but with it comes sacrifice. To be honest, I think both of these careers have sacrifice, and back in the day, I think historically they came with reputation, and you earn a lot of money for it. I think although you still earn a good living, if you want to make a quick buck and lots of money, don't do dentistry or medicine. It's not that. There are better ways of doing it. The grind is hard.
Yeah. Nicely put. Right, we're getting a few questions. Like I said, the interview questions, guys, I'm going to release loads of reels about answering your interview questions. I'm going to get a lot of interview questions like, how would you say, why dentistry, why medicine? We'll answer those when it's the right time, which is going to be in a few months' time. Right now, it's a different part. So personal statements, we're going to cover that in a few weeks' time. UCAT, which we've done a bit of, and we're going to do more with the courses. Got the QR codes for you guys there. Final question before we finish up, because I know you guys have both had a busy day, and everyone at home as well. You guys have had a long day as well. Son, it's another question for you is, does the army fund your degree? And I guess for medicine as well, if you want to be a medical doctor in the army, does the army fund your degree?
The answer is yes to both. If you apply while in university, it's called the bursar scheme. Look at army jobs, you do it. Incredibly competitive, but if you manage to get it,
What's it called,
it's great.
sorry?
It's the army bursary scheme, but you can do it as a medic, as a dentist. I think they even have it for vets. I can't quite remember the wanes and waxes, but generally speaking, yes, you can also apply as a direct entrant after. But yeah, you can.
Awesome. Guys, thank you so much for coming on today. It has been an amazing talk. It is every time you guys come and give this talk. Yeah, I love hearing from you guys. I'm sure everyone at home has done so as well. It is getting a little bit late, so I'm going to send you guys off. Thank you again. If there's any further questions, I'm sure I'll relay them to you, and we can do some joint Instagram stuff together that we can answer more questions for people. But thank you everyone for joining us today for the medical and dental school admissions workshop. Hope you guys enjoyed the UCAT element, enjoyed the talk from Sun and Nav, and hopefully see you guys at the UCAT course. Final chance for you guys to have a quick look at those QR codes. Remember, Medic24 if you want to get 20% off, and look forward to seeing you guys more for more work experience talks and the personal statement workshop. good evening.
Can I
And
just say
guys,
one more thing
yes.
for the small amount of people here? I know we joke a lot, but Bacta really does care about this and put so much effort in. There are a lot of people out there, and I'm sure they're great, but he genuinely really does care about you guys, and I'm sure he would be there for you. There are a lot of people who have messaged us. I would say message Bacta. He has all the answers that you would need, and if he doesn't, he can always text us. We obviously have our Instagram handle if you want, but generally, this guy knows his stuff. He's been doing it for years, and the results he's got from all his students couldn't speak more. So you're in
Why
good
can't you
hands.
guys be nice like that all the time? Why does it always have
They
to
have
be
you have to save
the
the
ball
end.
goes?
Save the
You
end
have
for
to
the
leave it till
funny
the
people
end.
out here,
Well,
you
when
know?
half the people have already gone, half the people heard you guys
Yeah.
roast me, right?
No, we got 40. We got 40 or so.
But
No,
most
I
of them are
appreciate that.
Bacta
I
and his
appreciate
cousins,
that.
aren't they?
Yeah,
Loads
no, I
of
appreciate
cousins.
that. Thank you very much. That was lovely. Right, with that, I'm going to leave it here. Thank you very much, guys, and have a lovely rest of your evening. See you guys later.